Let's bring in NBC News medical contributor Dr. Natalie Azar to break down the latest vaccine news and what we all need to know. Dr. Azar, always good to have you. So Dr. Natalie, let's start with the Johnson & Johnson news, that vaccine literally being rolled out as we're having this conversation. For folks who haven't been following this as closely, can you explain why so many seem to think that this particular vaccine is a game changer?
Absolutely, Craig. You know, I think we can really think about this as really transformative, both in the U.S. and also globally in terms of the vaccine response. And here's why. It was found to be safe as well as efficacious across age, race, with people with underlying medical conditions. It was very well tolerated. It is now, as we've reported multiple times, only one shot, and it has very forgiving storage and transportation requirements, Craig.
So, Doc, we know that the three vaccines are stored at different temperatures. I was hearing over the weekend that now the Pfizer vaccine, which we heard had to be stored at like -80 or something like that, can actually be stored at a less extreme temperature for a couple of weeks. How does that help?
Well, that certainly helps, Al. Yes. So the FDA did give the green light to Pfizer about a week ago that they could now store their vaccine in regular freezer temperatures for 2 weeks. The Moderna vaccine was already able to be stored for 30 days in regular refrigerated temperatures. And of course, we know that the Johnson & Johnson vaccine also can be stored at regular refrigerated temperatures for about 3 months. Why is this important? Well, it just makes the logistics of the rollout and the administration that much easier, really exponentially easier. And I think it's really one of those things where, especially for the Johnson & Johnson, because it's one shot, it's going to make a huge difference in areas of the country that have a less robust infrastructure. Think rural areas, community clinics, where healthcare providers will be able to administer the vaccine to recipients who may not have had access to these big, teaching hospitals and academic medical centers that had those extreme storage, freezer storage capacities.
On that note, there has been, as we've talked about, some hesitancy about the Johnson & Johnson vaccine when it comes to its efficacy rate. So in the U.S., it's 72% protective in preventing moderate to severe disease. Pfizer and Moderna's are roughly 95%. I know their CEO addressed it earlier this morning. The challenge is with the water cooler conversation, and I'm sure you've heard it too, people are making these comparisons as they plan to get vaccinated. And it's just, I know we've said they shouldn't worry about it, but people are comparing and they're saying, well, if I have to choose, why wouldn't I pick the higher percentage?
I know. And I mean, I think that that's human nature to just look at the numbers and try to make an apples to apples comparison. But you really can't. And here's why. Number one, the timing of the clinical trials was very different. Pfizer and Moderna, as you know, began in the spring when the predominant variant that was, or I should say the predominant strain that was circulating was the original, the wild type. As opposed to the Johnson & Johnson, their trial really started in October of 2020 all the way through January of 2021. And geographically, it was also very varied. 40% of participants were in Latin America. 15% of participants were in South Africa, where, as we know, more than 90% of those participants were infected or were exposed to the variant strain. So I think it's really important to keep in mind, don't worry so much about the 72% efficacy for moderate to severe disease, which, by the way, is a lot higher than the flu vaccine efficacy every year. But keep in mind that 85% protection against severe disease and 100% protection against hospitalization and death, which are really the only endpoints that should matter to most people.
Thanks.
And Dr. Natalie, I want to ask about two groups who I think would be pretty difficult to kind of do trial runs on. But Dr. Anthony said on Meet the Press on Sunday that we could see children under the age of 12 getting the vaccine by the end of the year or early 2022. So I'm curious, how do we do testing on kids? Also want to include pregnant women on that. How do we do testing, and are the trial processes as long for children and for pregnant women?
Right, Dylan. So to answer the first part of the question, no, the length of or the duration of the clinical trials for children is much shorter than it is for adults. Generally, as we know now, the phase 1, phase 2, phase 3 in adults, which enrolls tens of thousands of participants, endpoints, of course, there being hospitalization, severe disease, death. That's not what they're doing when they're studying children. Rather, it's really sort of an early phase 1, phase 2, where they're looking at safety, they're looking at tolerability, and they're they're looking for something called immunogenicity, which just means, are the kids able to elicit that robust immune response to the vaccine? After that, they do what's called like a bridge. They correlate that with presumed protection against infection in the real world. So it doesn't take as long, but, I was a little bit, surprised also when Dr. Fauci said probably not till 2022. But listen, as long as it's done safely and it's done the right scientific parameters, that's the way we want it to be done.
True.
Sorry, we didn't get to the pregnancy question.
Dr. Natalie, can we get one more live look, by the way, down in Kentucky? Because, again, the news has been so dreadful for so long. It's so good to see. It's so good to literally see those vaccinations getting rolled out this morning as we're having this conversation. Dr. Natalie, always good to have you. And with 3 vaccines now available, folks, a good time to remind you about your Plan Your Vaccine tool. There it is right now, planyourvaccine.com. You can head to the website there. You can see the rules in your state. You can also find out when and where you can get your shot. And, of course, the QR code, if you want to take out your cell phone right now and scan that, you can get the information that way as well.
We're getting there. Slowly but surely, we're getting there. I miss my family.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.